healthcare is not a public good. And some people will be offended by this, but this is not an opinion. This is a clear delineation of the definition of a public good, because a public good is a very specific thing in economics. Now, I have to admit, I do not like the word public good, and I strongly regret that the field of economics chose to name this thing a public good. It makes me mad because it constantly confuses students. But we have to go with the actual definition of a public good. So what is a public good? A public good has two properties. A public good is non-rival, meaning one person using the product does not in any way diminish somebody else's use of that product. And of course, if we're thinking about medical care, the most important input to medical care is attention from a doctor or attention from a nurse. And if you're with the doctor, you need them to be listening to you, paying attention to your case, looking at your knee or whatever. If that doctor is doing that, they cannot also be treating someone else at the same time. That is absolutely not possible. So every minute of the doctor's time is absolutely rival. It does not meet the criteria of non-rival. Healthcare is a good. And then the second part of the definition of a public good is that it is non-excludable, meaning it's impossible to exclude someone from getting it. And of course, with healthcare, doctors can say, I don't accept that insurance, I'm done for the day. Doctors can absolutely turn down patients. So healthcare does not meet either of these criteria. Now, we might say, well, what if the law says you cannot turn someone away from the emergency room? Or you could potentially create a law that said doctors cannot turn away patients. Although that doesn't actually fully make sense because a doctor only has 24 hours in a day, 7 days a week. So the doctor has to determine, the doctor cannot meet every patient that wants to meet the doctor. So that's not even really a practical law. But if you added a law that made something excludable, does that make the product itself excludable? And I think that's actually kind of murky. Like, I oftentimes use the example of education. Like, is education excludable? Well, certainly it's excludable. Like, if you don't pay for the college where I work, then I have to kick you out of class. The college would not allow someone to just come in and take the class without paying. So education is definitely excludable. Now, is public education excludable because, because public education cannot turn down a kid who is in their district? That's maybe a little bit murky. And when you actually start looking at public goods, the definition has soft boundaries to it. But despite those soft boundaries, there is absolutely no way that healthcare is a public good, because it's definitely rival. Now, there are elements of healthcare that are public goods, in particular, information about health. Once that information is out there, like once we've determined if you eat these 5 foods 6 times a day, then your chance of getting cancer is reduced by 10% or whatever. That kind of information is a public good because you put that information out there, and one person's ability to know that information does not reduce another person's ability to know the information. And it's really hard to exclude people from knowing information. So things like WebMD and research that's published, that's publicly accessible, all of that actually is a public good. So there's elements of healthcare that are. But if you're going to make an argument for why we need universal healthcare, you're going to need to come up with actual real reasons rather than calling it a public good when it's not. That just makes you look like you don't know what you're talking about. Please don't do that. There are great reasons to argue for universal healthcare that just don't have to do with a false definition of the word public good.